Arthroscopic surgery of the hip specifically is a relatively new procedure that has been available quite some time overseas and in other parts of the country. More recently, as the technology has improved, more surgeons are adopting this technique. And like other joints, we can use small incisions, we call them portals, to access the hip joint with a camera. And while we have the camera in the hip joint, we can see how bad a person's arthritis is. If they have loose bodies in that joint, we can remove those if those are causing the problem. Specifically, the most common thing would be a tear in what's called a labrum, which is a band of tissue in the hip, which can cause people significant pain. And through these small portals, we can place instruments to both repair problems as well as remove any other pathology that needs to be addressed. I chose to begin doing hip arthroscopy because I've had a number of patients come in who were either too young or who did not have significant enough arthritis to consider a big surgery like a total hip replacement, but certainly had pain in their hip and problems in their hip that needed to be addressed. When we see a patient with hip pain, part of the process is we will evaluate that patient with a clinical exam as well as x-rays. And patients who have very little arthritis to speak of, or have very early arthritis, or have significant groin pain are good patients to consider arthroscopic procedures of the hip. We would then send that patient for an MRI, a special MRI, called an arthrogram of the hip, that will let us see the details of the hip joint. And if there is a pathology in there, such as a labral tear, such as a loose body, such as even bone spurs that could be removed, then the MRI will show us that, and that patient would be a good candidate for an arthroscopic procedure, as opposed to someone with severe arthritis who would be a better candidate for a total hip replacement. The postoperative course after a arthroscopic hip procedure largely depends on what is done during the procedure. In some procedures, we simply do a clean out, or where we debride pathologic tissue, and if there's nothing that's repaired, the patient's recovery is quite quick, other than some soreness in the hip for 4 to 6 weeks. If we do repair the labrum, the recovery is typically about 2 to 3 months, depending on how extensive the repair is with the surgery. The advantage of this with an arthroscopic procedure as compared to a total hip procedure is that if we still need to do a total hip in the future, we can. We haven't burned any bridges, so to speak, and that's the advantage of doing these arthroscopic procedures. Every surgery has risks and benefits. The pros of this surgery specifically are the shorter recovery time and the ability to keep your joint that God gave you and to continue your activity hopefully pain-free, and to hopefully postpone any need for additional procedures. The risks of this surgery are typical of other surgeries, such as infection, bleeding, and those sorts of things. The patients with this procedure may get a little bit of a numbness in the thigh, but we would discuss that during the course. The biggest risk of this procedure is that the patient still has pain postoperatively, and that the surgery did not address the pain as adequately as as both surgeon and patient would hope. This is simply a tool that, like any other procedure, can offer great benefit, but also carries with it certain risks.